Hello, everyone. Wellness Whiz Jack Tips here to share a little bit of information with you about how to build an effective joint support program for your many patients. Now, to get our bearings on this really fascinating topic, we ought to go back to the 20th century, and we're going to pick up with a thread where suddenly there was a best-selling book on the market by a doctor named Theodosakis, and his book was called The Arthritis Cure. That was published around 1997, 1998, and had a lot of acclaim. Now, in that book, he presented basically the wonders of supplemental glucosamine, which is a compound made by the chondrocytes, which are really interesting cells in the body because they make the collagen matrix, but they, in the process, become embedded in it. So collagen is a living, supportive tissue. He also presented on chondroitin sulfate, which is also a compound made in the cartilage. And today, supplemental forms come, from chitin or shellfish, such as lobsters and shrimp shells and things like that. Now, suddenly there was a book in the mass market that was claiming, finally, from a medical doctor, here's how you cure arthritis. And it was all done with basically nutrients and even supplements, which he was glad to sell. So suddenly we start seeing studies that were promulgated by Big Pharma. And they basically came out and said, nope, the research is all wrong. All these other research studies really weren't right. Ours are right now. And there's no efficacy into taking glucosamine chondroitin type supplements, despite the many thousands of evidence-based studies that were presented and that natural health practitioners in particular were already finding in their clinical work. This caused the doctor to go back. He issued a part 2 book in around 2004. And we saw a little bit more about the topic of another nutrient called MSM, which is a form of sulfur. And so, meanwhile, many people kept getting results with the nutritional approach. And so really what we ought to do here is we ought to run through some facts. So we can have mastery and a better overview and to know the scope. Exactly where can we work? Where are we effective? What do we need to do to help others with their joint health? Now, I'll just mention it comes to pass that anyone over 50 years old should at some time during their calendar year do a specific time of joint support. Too much is at stake if there's physical impairment coming into the latter years of a person's life. So we will simply say, if I hear of people over 50 and they start having joint issues, it's really time to preempt any further issues. So let's look at some of the things we do know here. Number one, we should keep in mind the concept of biochemical individuality. It was some 65 years ago that the great Dr. Roger Williams, a biochemist, a bio teacher at the University of Texas, published the book Biochemical Individuality, where his discoveries that were coming into the forefront were that each person has unique nutritional needs. Each person's body is as unique as their fingerprint. And so from that perspective, of course, the book had some degree of controversy about it, as the role of medicine was basically at that time seeking to put all people in the same test tube. And there, this great researcher comes forth with, hold the phone, just a minute, we're all unique and different, and we really need to be looking at the differences. Well, it's been now literally 60 years or so for this research. And now we're finding, after much kicking and screaming, medicine is being drugged into accepting this model because of looking at people's genetics, realizing that one person responds well to one drug, another person might respond to another. Different people need different doses. And so we do find then that Dr. Roger Williams was indeed correct. Now, so we know that we have to address the cause in our natural health model. We're always looking for the cause. So we're going to have to look at the several causes of joint decline, we'll call it, whether we talk to someone who's been professionally diagnosed as having arthritis or whether they just have sore damaged joints. We have to look at sustaining contributors. And we want to be able to kind of initiate remedial nutrients that address the body's normal, natural, innate processes of joint repair. So there's awfully good evidence now, at least from the evidence-based information, on glucosamine, chondroitin sulfate, and MSM as being important to supporting the joints. Now, other studies point to, let's say, proteolytic enzymes, that they support the cleanup of protein artifacts in the bloodstream. Other studies support to normal, natural anti-inflammatory processes. Other studies will actually point to specific herbs, such as devil's claw, for the normal inflammatory related conditions. There's much written about devil's claw on arthritis and arthritic pain. The coleus plant, also using helping the body utilize its normal fat for energy processes, shows to have excellent impact for the joints specifically. And we're going to look at a superstar in just a minute, Boswellia, the frankincense, that we have now on a blog called Herbafolia, herbafolia.com, where we discuss the epigenetic and metabolomic impact of herbal research. So on that blog, we're looking at the latest scientific research. The first posting is on Boswellia. We'll talk a little bit more about the wonders of Boswellia and how absolutely phenomenal it is. Now, other studies for joint health turn us toward the subject of mitochondrial dysfunction. So it seems like now in this part of the 21st century, so much of what we must consider is the role of the mitochondria in all kinds of chronic degenerative and even autoimmune diseases. Now, there we'll find more studies on the Gymnema sylvestri, an herb that is famous for supporting glucose metabolism, thus mitochondrial function. We could even consider with some people, they might need a formula that's more modern and up to date, such as a systemic sinulin formula for overall cell membrane insulin receptor sensitivity. Now, we also can find regarding joint health that there's over-exercise of wear and tear and too many free radicals being generated by the person who is over-exercising or over-indulging in certain body motions. And we also find the under or the sedentary joints, which maybe have lost out in the concept of if you don't use it, you lose it. This is called neuroamnesia, where the brain can just forget about it because it seems the body's not using it. And so we need to be sometimes looking at reactivating the body's neuroplasticity of the brain. as we work with programs. Now, this happens to be an area where I've spent the last 4 years in intense research developing a program called the Limitless Living Program, which we find that in some early conversations with Dr. Shane Morris, that this may well be something that can be made available to people working with systemic on behalf of your patients. Now, back in the 20th century, Doc Wheelwright, one of the early mentors of natural health and an eclectic healer in his own right, he taught a rather revolutionary concept, and it was that pathogens impact the joints and cause joint destruction. This was resoundingly not acknowledged because medicine was wanting to stick with the story that joint issues were strictly metabolic concerns and not pathogenic. If they were pathogenic, then why wouldn't all the massive antibiotics being given people basically provide a collateral golden ticket regarding not getting arthritis and joint degeneration? But what Doc found was that certain pathogens, and he identified them as strep mutants and amoebas. Now, after he did that and went online meaning he stated clearly in his teachings and writings that pathogens, that arthritis could be an infectious disease, that it was published in the Lancet, the British medical journal, that indeed they found that amoeba could be involved in arthritic symptoms and recommended the drug Flagyl, which gave over some 60% of the people taking it relief into the arthritic condition that they were experiencing. So Doc was exonerated in his radical statement. And what Doc taught was that as a pathogen, such as a strep mutant or any pathogenic bacteria, could generate inflammation processes within the joint, that the macrophage would start destroying the joint, and that the joint would release additional materials that would be clumped up as a hard matrix around the joint, which we know as the nodosities that appear today. Doc taught that the body might even take calcium and put a shell around that pathogen to lock it in. That amoeba couldn't run around anymore if it was put in prison. And thus the calcium mechanism is flourishing and so forth in this process that, if it goes on too long, can cause a crippling effect to the joint. So why don't we look clinically? Now, I've mentioned 8 things just to remind us here. We know about biochemical individuality. We know there's certain nutrients, glucosamine, chondroitin, sulfur of MSM. We know there might be the need for anti-inflammatory proteolytic enzymes, devil's claw, coleus, boswellia, gymnema sylvestri. We can understand that there's overexercise, underexercise. We can understand that in this same bucket here, we've got Doc Wheelwright saying that there might be a pathogenic aspect to it. And so from these 8 things, why don't we see how to design a program? Now, way back in the old days, which has to now admittedly be my forte in spite of keeping my nose on the latest research and the latest techniques, I used to teach something called the wheel and spokes diagram. It's a way of thinking. And so I'm going to go back into this concept. Now, somewhere along the line of teaching over the years, this concept of wheel and spokes seem to have fallen out of vogue. There was somebody that says, well, I don't like it or I don't get it. But basically, a wheel, like a wheelwright, had to have a hub. And that hub would have spokes radiating out from it to the rim. And it was the wheelwright's arcane art to decide, does the wheel need 12 spokes? Is that going to have it vibrate properly when it spins so it doesn't break? Or maybe 6 or 4 or 8. And these were some of the secrets as far as load and type of materials that a wheelwright went into about the spokes. So here we go. We have the hub. This is going to be the core program that everyone needs. If you have symptoms of the condition, you need the core. The core is universal. Now, each radiating spoke would be a biochemically unique aspect that might have to be addressed. Thus, when we combine the core and 2 or 3 spokes, we now have effectively custom designed a program for that individual. We know we're universally accurate because of the core, and now as doctors, we've listened to the patient, we've made determinations of causes and contributors, and we're able then to add and create a comprehensive program. That's the model. See if you can follow along. First, the core supplements. Now, the JOT formula, I'm going to grab the handy sheet here that is provided to you, which is called the one pager, and it gives some quick reference insights to the formula. So JOT number 133, joint disc cartilage, on the 8 criterion that I rattled off, it meets 6.5 of them out of 8. This is phenomenal. Obviously, a core formula, and one that many clinicians will attest gives great results. So I've always been wondering over the many years at the turn of the century, why does the JOT formula keep bringing excellent results when used for 90 days to people that are complaining about stiffness in the hands and trouble opening a jar and things like that? Why does the JOT again and again perform? And yet we saw this fervor of research studies that go, yeah, those key ingredients are great. And then we saw refuting science come forth. Well, maybe they're not really so good. And but out of the controversy, evidence-based says, hey, this is one important formula. And guess what, it's going to have in it? It has the boswellia, it has glucosamine, it has chondroitin, it has the MSM, it has the devil's claw, it has the coleus, it even has turmeric, which is just one of the all-time popular anti-inflammatories, which means that turmeric gives support to the body's normal, natural inflammation resolving processes. And so we don't look at an herb like turmeric or anything as being anti-inflammatory, because that would be suppressing one of the body's normal natural processes. So we want to hasten the end, the resolution of the cause, not just shove down inflammation and letting the cause of the problem go unchecked. So as we look a little further, again, I'll point you to herbifolia.com. Please read the article on boswellia. Please comment on the article if you liked it. If not, if you have something else to add. This is a new forum for us to engage in ongoing conversation and clinical support. So back to boswellia now. We want to point out something. When the world of epigenetics, where it's how the body is responding to foods, to thoughts, to the external environment, that we want to understand, please, that sometimes it only takes a little bit a smidgen of an herb to remind the body how to organize molecules and how to respond to the environment. So one of the great works and the research on Boswellia show that it's very powerfully epigenetic toward anti-inflammatory. It's a nootropic, meaning that it supports a youthful brain. The research out of India put Boswellia heads up against the top arthritis drugs put out by Big Pharma, and their findings were clearly and scientifically validated that Boswellia works better than the medical drugs. So we have a simple herb called frankincense that is used in incense and Indian temples. It was a gift of the Magi to the baby Jesus. Actually, Jesus was a young child at the time Boswellia arrived. But the point is that this is a powerful, fabulous herb that was actually used as a coin of the realm, as something that was literally worth its weight in gold. Now, here's the thing. Boswellia dampens tumor necrosis factor. Well, that's an important epigenetic signal to give the body to maintain youthful longevity and to watch out on the body's, let's say, failure to block the development of tumors. Now, Boswellia works unbelievably like so many medicinal herbs. It works both ends of the problem simultaneously, where a drug only works one end. Now, the drugs that were used generally for arthritis are what's called COX-2 inhibitors. But here, Boswellia not only addresses the COX-1 and 2 systems, but it addresses another side. I'll tell you here what it is. Boswellia addresses the overproliferation of the macrophage response that goes in and destroys the joint tissue as collateral damage. So when there's a high and mighty position of medicine of we don't have the cure, but we're going to retard the damaging process. We're going to give you more years of healthy joints or better functioning joints if you just take our suppressive drug. Okay, nice. We don't have as much rapid deterioration, but Boswellia shows to be superior. It's going to not only stop and inhibit the body's natural or support the body's natural processes to inhibit the tearing down of joint tissue, it's going to also check the over process of the building up. This is where the body tears down the joint tissue and then tries to build up a nodosity, right? The deformed hands we might have seen with people, or the big bulging, hard nodosity on someone that is bulging out through the skin of the buildup, the unproliferated buildup. So Boswellia is going to come at it from both ends and be helping the body epigenetically support its health. Okay, so the JOT formula is the big one, the shoe-in, that I think periodically, maybe every 6 months for people over 60, maybe once a year for people over 50, we need to look at focusing on the joints so that at 90, we can be hopping in and out of a car, opening jars, climbing the stairs, bouncing around the house on a pogo stick, whatever we would set our standards to be. We have to nourish the joints because they're the working machinery. There's what needs to be oiled regarding wear and tear. And speaking of oiling the joints, Doc Wheelwright in his research found that the MPR formula, the curcubito pepo oil, was brilliant for synovial fluid and supporting the joints. So these are just what we would do is put a wheel and spoke. Now we have our core started, the JOT. I'm going to have 2 more formulas there, but a spoke radiating out might be, this person's got dry joints. This person has a history of bursitis. This person has creaky knees. This person, like the Tin Man, needs a little shot from the oil can in the joints, we might be looking to the fatty acid formulas. In our core, I'm choosing a different one than MPR. I'm choosing the RPM. That's because of its propensity to resolve normal natural inflammation, that we're going to resolve an inflammatory process. So here, so much we learn that the body chooses to have inflammation. It's for a reason, but the body needs to turn it off. And to turn it off, the cause has to be resolved. Well, we find it's the EPA, DHA from the superior source of krill oil, that those EPA and DHAs are ever ready with the myrisins, the protectins, and the resolving molecules that the body will grab to turn off inflammation and initiate the healthy, normal rebuilding process. So in our core, we have JOT and we have RPM. And finally, I have a secret recipe for the third core component. Seldom in a wheel and spokes diagram will I have more than 3 formulas. And the third all-time big one is going to be collagen. Now, collagen, according to the research and the massive amount of research that I've done on proteins, collagen is far and better than the whey protein. Now, whey protein has other factors for immunological, for the gut and so forth. But when we want the protein matrix for the bone, the muscles, the joints, we're turning to the collagen peptides as being specific, basically nucleoproteins ready to go to work. Keep in mind, as people age, their hydrochloric acid is lower, they're absorbing less protein. They're making less amino acids. Their gut microbiome is weaker, less diverse. They're making less compounds to pass through to the body. As we get older, we need to put our focus back on our nutrition, just like it was when we were a young child and people were saying, you've got to get calcium for your bones. You've got to get your protein. You've got to get your vitamins, eat your vegetables. After this grace period of the peak of the bell curve, people over 50, they need to start looking at digestive support and how to support key moving part tissues. One of our number one moving parts of the wonders of the human body is not our mouth that's always wagging, not the teeth that are always getting food stuck in the pie hole. It's our joints that give us the freedom of movement. So important point there. Here's my secret recipe. I like to take the collagen ECM, extracellular matrix, and the collagen MB, muscle building, because of some of the other ingredients in the muscle building formula, and just dump them together. Now, we're going to do this program for at least 60 days, and generally we often need 90 days when someone can then step up and go, wow, I am so different. I am so improved. And so the rebuilding of joints doesn't necessarily turn on a dime and we have it's been 2 weeks, are you better? No, it's more like let it play out for a good period of time, and I like 60 to 90 days. So here we get 2 buckets of the collagen and just dump them together. Stir it all up, a scoop a day. Great way to get a wide variety of collagen peptides. There's over 16 forms of collagen. So the fact that we're mixing 3 or 4 forms here between the ECM and the MB collagen formulas just means that we're getting a broad spectrum of usable, bioavailable, cell-ready collagen. So here we go. There's our core. JOT, collagens, and then the RPM. Again, if someone was particularly dried out in the joints, I might look at bringing MPR. That's one of our first wheel and spokes. Now, how do we individualize joint health? We have to ask, what's the cause? What's the contributors? I think going to the top of the list is going to be leaky gut. So people have had a history of SIBO or SIFO, that's small intestinal bacterial overgrowth or small intestinal fungal overgrowth, that we find that they by default have leaky gut. People that have been eating a lot of commercial grain, the hybridized wheat, without fermenting it or making it at all acceptable to their bodies, may be finding that they have a wheat like a gluten factor or a gliadin aggravation of their immune system. And so we look at the diet according to the dietary principles that we want to follow or that we advocate. And we're going to, of course, as nutritionists, we're going to implement some kind of dietary advice. But if a person, we know they have leaky gut, and maybe they're going through that leaky gut protocol, we just want to draw attention to the L-GUT, leaky gut formula. We could point to the MBC as a probiotic. We could look at FBR as a prebiotic, all of these things working in that area. Now, we also talked about wear and tear. That just takes us back to the JOT. So if we had a spoke coming out of the hub for wear and tear, and then we want to list the formulas, we already have that one covered. That's why this wheel and spokes model can be so quick and easy. Also with diet, we want to look at the positives, right? Not only removing the negatives, but we want to be sure they get the positives. I think one of the most positive factors here is the collagen. If we know they're low on sulfur, that would be a factor. Blessedly, we have the MSM. Are they low on antioxidants? Maybe that we've seen that the person has a low oxidative much oxidative damage. And so we could look at ROX, ROX. We could look at G-cell. We could look at EPIC, and we might want to add to it. We can also understand from our 8 criterion glucose metabolism in the mitochondria. Now we can look at E-energy. We can look at sinulin. And they might have, basically, we might determine, oh, well, the blood is pretty toxic. Maybe we want to clean up protein artifacts, also with leaky gut being a part of that. So now the MELA. So as we have this wheel and spokes concept in our head, we can gravitate right to the top 3. And then we want to add anything to that fits the individual and fits our studies and how we're engaging to help people. So there you go. There you have it. There's a model and a matrix for looking at the best of joint health. I hope to have further conversation from you on herbifolia.com, and we'll talk a little bit more about the wonders of Bosley Lee. You take care, and thank you so very much.